To quickly review our anatomy, there are three main categories of the venous system. We have our deep veins, the superficial veins, and then our perforators. The deep veins serve as the reservoir for our blood. The majority of our blood is stored in the venous system. The deep veins are also the main conduit for blood to return it back towards the heart. The deep veins are associated with an artery. The artery can serve as a landmark when it's difficult to find a deep vein, such as in the presence of chronic DVT. That artery serves as a landmark. The superficial veins, they do not travel with arteries. The superficial veins are typically closer to the surface of the skin. Their purpose is to help regulate body temperature. They are superficial to the muscle fascia. They are typically smaller than our deep veins in the lower extremities. And then, of course, the perforators are the small bridge or communicating veins that connect the superficial and the deep system. They obliquely perforate the deep fascia and move blood from the superficial to the deep system, and then the deep system moves the blood back towards the heart. In our leg, we evaluate these vessels with our ultrasound system. We typically are starting in the right common femoral vein here. Right here in the common femoral vein, and then we are evaluating the deep system through the femoral vein and into the calf veins. Here's the posterior image with the popliteal vein and our superficial system, also reviewing our superficial system anatomy. We'll dive a little bit deeper into this anatomy. We've got our perforators, our group of perforators here, the Coca perforators and the Boyd perforators. And recall the perforators are those communicating veins that connect the superficial and the deep system. Our saphenous vein travels more medially and originates near the medial malleolus and then ascends the leg on the medial aspect, draining into the common femoral vein. Where it enters the common femoral vein is the saphenous femoral junction. There are multiple tributaries and accessory veins in the superficial system. Our saphenous vein, short saphenous vein here, originates near the lateral malleolus and ascends the posterior calf, traveling in the middle. It typically enters into or drains into the popliteal vein and the popliteal fossa. However, there can be several anatomic variants. This area, this junction, would be the saphenous popliteal or SPJ junction. SPJ is saphenous popliteal junction. And then let's get back here. Our valves. The valves are a very important component of our venous anatomy. They're bicuspid leaflets that point towards the direction of normal venous drainage. And through a series of synchronized movements with the surrounding muscles, valves help regulate the blood return towards the heart. Typically, our venous flow, it's coming from our skin, those superficial veins that are close to the surface of our skin to help regulate the body temperature. Then it drains into those tributaries, and the tributaries then drain into the saphenous vein. And from the saphenous vein, the blood will move through the perforating veins or through the junctions, those two junctions, the saphenous popliteal or the saphenous femoral junction, and then into the deep system and back towards the heart.